This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right. Well, good evening to everyone. And so it looks like technology is working pretty well for us at this point in time. My name is Dr. James Atchison. I'm the program director and chair at Mayo Clinic Florida, which would be about 60 to 70 miles east of where you were just a minute ago in Gainesville. And so we're more over on the east coast of Florida, and we'll talk about that and show you some pictures a little bit as we get going. I'd like to also welcome Serena Patricara, who's our program coordinator. She's going to try to answer the chat questions if you have some as we're going through, and then I'll try to pick up things at the end, but not real good at talking and reading chats at the same time a little bit with that. The Mayo Clinic is in Florida, is part of the Mayo Clinic overall from Rochester, Minnesota, started by W.W. Mayo at the middle picture there. That's the father of Charlie on the left and Will on the right, who are the two doctor brothers that kind of developed the Mayo Clinic into what it became in Rochester. And their philosophy is still maintained throughout the system. And that's part of what we function under at Mayo Clinic in Florida. We practice what we call the 3-shield approach, which is education, research, and patient care. In PM&R, we have just recently started the education program, and I'll share more with you on that. We have our first class that started just a few weeks ago now, and talked to them some last week where they're doing well. Emphasis on patient care and research, but these are the faculty expectations with people we hire to come and work. The primary value listed for the patients at Mayo is the needs of the patient come first, and that's been I know it sounds like a cliche, but it's been there for now over 150 years since they started in the late 1800s up in Rochester. This is something that you'll hear faculty and staff and other residents talking about as you work through the services that you would have in our hospital system. Just a little bit about the campus in Jacksonville. We opened in 1986. Started with 30 doctors and about 200 employees, and now with more than 400 different physicians and 5,800 staff. We have a campus. I'll show you some pictures. And so it is kind of like a campus. We're the only really activity going on the campus. So it is a pure medical campus. We are the #1 ranked hospital in the state of Florida and getting close to the top 30 in the country. This is based on the U.S. News and World Report rankings that go out. Currently at 304 beds, but there is construction going on. The areas in blue right now are about 2/3 done. So by the early part of 25, we will be at 400 plus beds and still room to grow more from there. You can see the campus, all those buildings in that picture are basically Mayo Clinic and research buildings, discovery buildings, administrative buildings, but there's not any other conflicting activity going on campus. Proud to say we were number 50 in the GME program, so just happened to be a nice round number for us to get approved and started. On campus, there's over 250 and probably getting closer to 300 residents and fellows at this point. We are partnering with Brooks Rehabilitation in Jacksonville from the standpoint that Mayo Clinic, PM&R, we do primarily outpatient management. Brooks has been the inpatient rehabilitation center in Jacksonville now for more than 50 years since they started. They have 2 large rehab hospitals with more than 170 beds, and we'll talk about the services in a minute as we go through what rotations you would have and where. They also have 2 skilled and subacute facilities. Currently, those would not be required rotations for any of the residents. They will be available on electives, but there is also discussion at the national level about whether the PM&R ACGME requirements are going to change to include a requirement for subacute facilities. So if we need to do that, we have them available. Some other areas that are quite fascinating at Brooks, they have an outpatient neuro recovery center. And what it is it's basically an outpatient gym for people who have been through their programs with brain injury, spinal cord injury, stroke, that can come back and work out independently on their own. And so the patients pay like a $5 a month fee or something like that, and they can actually come in and use equipment that's designed for people in wheelchairs or with impairments, or they can do, you know, weight assisted walking. There's a track they can hook the device into in order to be able to do those things independently themselves. They have a clinical research center, which we'll talk about with Dr. Bowden, who started here recently to develop that. And then they do have a very robust adaptive sports program. And it's one of the things you don't think about a lot. We all think of wheelchair basketball, and we're about ready to get an opportunity to see the Paralympics coming up with a lot of different sports. But when you're on the ocean and you have beaches and you have other things, we often can find different sports for people to try and attempt and tackle too. So surfing is one of their favorites from the Brooks Adaptive Rehab Program. Brooks is currently ranked #1 in Florida for all of the rehab hospitals. And so we are happy to pair with them as the #1 rehab hospital and #1 hospital system in the state of Florida at this point. We are a new program. We are 4-year categorical. So just as I caught the end of the last talk from UF, they are a 3-year advanced program. We take people to start at PGY1. So you move to Jacksonville and you're in Jacksonville for 4 years when you come to our program. We are taking 2 residents per year, and Dr. Khan and Dr. Prathup are our first 2 residents that matched last year. So they now have a whopping 3 weeks of experience at Mayo Clinic, Florida, and still have smiles on their faces like they do in the picture so far. They are looking forward to moving past PGY1, I would say, and moving into the actual 3 years of PM&R training. They will have 12 months at Brooks and 24 months at Mayo. Now, the 12 months at Brooks is broken up into different years. So there's 7 months during PGY2, 3 months during PGY3, and 2 months in PGY4. Much of that strategy is so that you get some reintroduction of topics each year so that you're ready to take your boards at the end, and you're not just limited to inpatient during PGY2. There's some variability between doing inpatient, outpatient, rotating some back and forth between the 2 sites. Just a brief summary of what goes on during the preliminary year. This should be very similar to wherever you would do a preliminary year, because these are things required by the American Board of PM&R. So you have to do a certain number of months of medicine. We can do medicine electives, which are neurology, rheumatology, things like that here. The board only allows 4 weeks of PM&R during your PGY1 year. So we have 2 weeks at Brooks, 2 weeks at Mayo, just to get everybody reoriented to the system so that when PGY2 comes, you'll be ready to roll. But one of the challenges is you can't go do a lot of other PM&R during that first year because of the board requirements. And that should be pretty similar in any program. Just sharing some pictures of faculty. Besides myself, we have an associate program director over at Brooks, Dr. Trebuzio. Also faculty at Brooks running the brain injury program, Dr. No, and for spinal cord injury, it's Dr. Tanuzzi. We do mostly, as I said, musculoskeletal and outpatient at our facility. You see Dr. King, Dr. Troyer, Dr. Marshall will be joining us in October. She just finished her cancer rehab fellowship at Sloan Kettering. Other consultants we have, Dr. Warsowitz primarily does our inpatient consults, and then Dr. Rubin is a neurologist, but he runs the EMG lab at Mayo Clinic, Florida. And so part of your training will also be under their direction while you're here. So at Brooks, for the 12 months you're there, it should be pretty similar rotations, I would think, to what you'll hear from most programs about spinal cord injury, brain injury, stroke, et cetera. The difference would be Brooks has got a very large number of beds. They are going to have a very robust experience with spinal cord and brain injury patients. And certainly stroke population in most areas these days is also very large just by the nature of our aging population. We also from Mayo send them a fair number of transplant and oncology patients. So we are not a level 1 trauma center at Mayo Clinic, Florida. So we don't do usually acute brain and spinal cord injury on our campus. You'll see them at Brooks, but the group that comes from Mayo Clinic over to Brooks has got usually much more complex medical issues, and then they're debilitated, and we need some of the inpatient rehab for that. Also, there is a requirement to do a 1 month of pediatric inpatient, so that's also done at Brooks. They have an adolescent unit. At Mayo Clinic, Florida, on our campus, we're going to look more at the musculoskeletal, ultrasound, sports medicine, the outpatient neuromusculoskeletal things, plus pain, neurology, different areas like that. There will be opportunity to rotate through some of those again, which we call selectives, where you can choose which ones you want to kind of get an update or reinforcement on. In the program, as all programs, there's a requirement for electrodiagnosis. You should be completing at least 200 independent studies by the time you finish, which takes several months to do. So during PGY3 is the time when our residents will be in the EMG lab and training with the EMG fellows at that point in time with Dr. Rubin, who's pretty nationally known in the EMG world. On inpatient consultations, Mayo Clinic, Florida, although we're not a trauma center, we do see a very acute and complex medical population, which you'll see during PGY1. But as a consultant later in PM&R, Dr. Warsiewicz does a lot of the consults in the hospital, and we'll be deciding what level of care different patients need as they move forward. There is also a requirement from the board for outpatient pediatrics. Dr. Spire, who's actually faculty at UF in Jacksonville. So you heard about UF Gainesville that has a residency program. There's a UF facility in Jacksonville. They do not have a PM&R program. And she is a pediatric physiatrist. And so she is part of our teaching faculty with the rotations and the residents here. Also, each year there's time for research, which we're going to talk a little bit more about the requirements, but under Dr. Bowden, who's the vice president for research at Brooks, with some leadership and mentoring. He's a PT, PhD, who is in charge of their research program. Continuity clinics is also something else that should be on the agenda for all the programs you look at, and we will set that up beginning in PGY3. Just to go through, we have a didactic curriculum, as I would say most programs do. Part of the difference, we have a very amazing simulation lab, not only from the technological standpoint, but from the simulated patient activities that are live. And we will be doing a lot of our anatomy lab work there with some virtual, some actually with cadavers. But the idea of incorporating different learning styles and newer technology into our curriculum is part of what we're striving to do. Other meetings and education that occur is one of the things you do need to learn as you're training is what's going to go on in practice. How do I run a practice? How do I administrate a rehab hospital? How do I do things that are going to be potentially part of my job when I finish learning the medicine part? So going to medical staff meetings at both facilities, we have those monthly at our place and at Brooks. And when you're rotating in one place or the other, you have the opportunity to come and do those things with us as we all learn how to continue to develop and administrate our own programs at this point. From a research standpoint, there will be one required project during your time. Starting it, if you want, during PGY1, the medicine group would allow that to occur to get ball rolling. If you wait to start a PGY2, we are going to have an introductory course in research design and, hypothesis formation and things like that. You'll have some time on each rotation, but each year there is a 4-week block, which is designated as research versus elective. And so you and the program director will sit down and have a discussion. How's your research going? And if you're pretty far along and you'd like to go do an elective, all right, we're going to look at that very favorably. If you haven't really started your research yet, then during those 4 weeks, we're probably going to try to use that time to get you started and get things moving forward so you can actually have a project ready to go by the time you're finishing your 4th year. Research Day is going to be presenting topics as a PGY2. Obviously, as we're starting through our program and we get to next year, there's not going to be any PGY4s yet. So we'll just be talking about topics and then come back with the results when people are in their 4th year. As we move forward with other options in the program, on-call responsibilities in our setting are quite different. Brooks is a institution where they have hospitalists. So the rehab doctors take call from home on certain rehab topics. For the acute medical problems, they are going to call the hospitalists. So you do not have in-house call when you're on the inpatient units. There will be call 1 night a week for the service that you're on for the rehab questions. The challenge with that is if you don't learn how to take call and manage patients that are maybe having a problem at night, when you go out into the world and you go to work for a rehab hospital, they're going to expect you to be able to do that. So with the situations we're in, we're going to move that back into our simulation lab and start to develop what happens when the nurse calls you because they're short of breath or having chest pain or throwing up blood or some of the other things that commonly happen in rehab hospitals. But we're actually going to need to practice those on the simulated patients rather than doing it on the patients that are in the rehab hospital. When you're on an inpatient service, you work 1 Saturday a month out of the rotations you're on. When you're on the outpatient service, there are no nights or weekends. It's going to be straight during the week. The other thing with on-call is the preliminary year in medicine at Mayo. You're either working days or nights. They do not have any 24-hour shifts. So you do have some nights, but you work straight nights. So you go home during the day and sleep and come back the next night, which is different than a lot of places where they're designed to have you there day, night, and then go home and sleep for a few hours and come back the next day. So they are very proud that they kind of don't have students and residents and people doing that at Mayo Clinic, which has been shown to be a challenge for most people. Teaching responsibilities. So as always, I hearken back to the 3 shields with teaching, education, research, clinical activity. We will expect residents to behave in the same manner because we have people who need taught, students or other residents from different services that come to rotate with us. You'll have the opportunity to teach them along with the faculty member that you're working with. Just a little bit about benefits. I put the internet login in there so you can go into that. It's very well published and easy to pick out and read, but we started about $69,000 for this next coming year. Insurance, including medical, mental health, obviously malpractice. There are voluntary, meaning you can purchase life, dental, vision, things like that. Once again, there's so many different benefits. I think it's probably better if you go in and read about them on that link right there. I am happy to tell you we're opening a brand new wellness center actually next week. It's a full-scale gym in the building right behind the hospital. It's called the Stabile Building, but it's open 24 hours a day to all employees. So if you are wanting to work out on campus, et cetera, you'll have facilities to do that as well as locker rooms, et cetera. The other support staff group that's very important and we find for all of our employees is through the Employee Assistance Program. And so the wellness factor is very much alive on Mayo Clinic Florida campus and very active. And so those are things that you would expect to have support as during your residency also. Vacation and trip policy for our house staff is 20 days of vacation per year plus 6 major holidays. So if you work one of those holidays and you get a flex day from there. We do not have sick days per se for residents, but if you are needing to be at a medical appointment, it's expected that you're going to be released to go do that. So it's not really formally where you have to apply for those kind of things. One of the better perks, if you will, for the program is through the trip policy. So there are up to 10 days per year for you to present your related research activity that you've been working on. So when we are harking at you as a PGY2 to get going and get started, part of it is if you can get a poster accepted or something accepted at one of the national meetings, then Mayo Clinic's going to fund that, and they will fund as many trips as you can get yourself into situations in order to do that. And so beyond that, there is what we call one attendance trip, meaning you're not going to a course to present, you're going to just sit and learn. And that's one time during the residency, you can have up to 5 days. And I would tell you from our sister program in Rochester, many of the residents use that during their 4th year to take, like the board update or the board study courses in order to be able to do those kind of things. Ultimately, the whole goal is to be able to take the boards. And at the end of any program that you look at, this should be the bottom line. You want to have the right curriculum so you're eligible for the boards. You want to do well on that curriculum so you understand all the topics where you're going to be able to pass the boards. But ultimately, when you finish a program, you're kind of not done. You have to finish taking the boards. In PM&R, if you're not aware, you take step 1 of the boards after you finish your residency, and then you take part 2. We actually call them part 1, part 2 instead of steps. Part 1 is right after your residency program in August. Part 2 is in May the following year, which is still oral boards. And so we are one of the specialties that does continue to use oral boards. Here's a picture of Jacksonville. You are looking across the St. Johns River in downtown Jacksonville. That is not the Atlantic Ocean right there. So it is water-based downtown, but it is the St. Johns River. And for those of you who like trivia, it's one of the few rivers that flows from the south to the north instead of the north to the south, which is how most rivers flow. We at Mayo Clinic, Florida are about 10 or 12 miles from downtown if you move southeast. So we are closer to the beaches. In fact, we're right across the intercoastal Atlantic pathway to move out to the island, but Mayo sits right on the edge of that. Jacksonville in general is an outdoor place. People move there, stay there for outdoor activities. We have everything going on outdoors with music, athletics. Probably the only downside I'd say right now is it's kind of like an oven outside in Jacksonville. Although the ocean breeze is pretty good most of the time coming off of the water, but it is hot in the summer. But it's going to stay very temperate during the winter and does not have, I think we might have had one day last year where it dropped down as low as 32, but really didn't stay there at all. We are on the coast, so once again, you'd be an hour and a half to 2 back to Gainesville, where your last presentation was from. Similarly, we're in the north corner, so you move south to Orlando, you have to go really south to get to Miami. Tampa is on the other side of the boot as you go down, and so it's not as close either. Moving up the coast north, you go to Savannah, then you come to Charleston and those areas as you keep moving north up the coast from Jacksonville. I put in the email addresses for things you want to think of later on. As I said, Serena's online with you now, hopefully been answering most of the questions for you so far. The other thing I did want to put in is skipped one. Yep, there we go. Back up to the slide where it has some links on it. So if you have to pull up the YouTube version of the talk tonight, there are links where discussing from Dr. Hedges, who runs the internal medicine preliminary program, more about Brooks, more about Mayo Clinic Florida. At the very top is our residency website. We're in the process of updating that to get Dr. Khan and Dr. Prathep's pictures on there as our inaugural residents to get started. And I will pull out of there and maybe stop sharing. And if we have any time, I'll be happy to take on-site questions.
Yeah, Dr. Atchison, thank you so much. You're more than welcome to answer some questions in the chat.
Okay.
There's